Joliet. So it's Terre Haute and Joliet. He moved to Lafayette, and he was like a fish out of water because there was no federal prison here. So when Russell Portman retired, David came to our practice, and we were together in veterinary practice for 25 years or so. And now he's moved on to the State Board of Animal Health, Director of Poultry and Meat Inspection for the state of Indiana.
Well.
Thank you, John, for those kind words. We've had a PowerPoint. We'll start here in a little bit, but golly, everybody's going down memory lane and talking about memories, so gotta start with some memories, I suppose. First of all, I must say I'm excited to be here. John asked me to come and speak, and it's really a nice opportunity because in our agency, whether it's State Veterinarian Dr. Marsh or one of myself or one of our colleagues, generally we're speaking to producer groups, Meat Inspection, Meat Packers Association, the Dairy Farmers Association, legislators, or Purdue Extension groups, farmers markets. So this is kind of more mainstream. Right. And so that's a great opportunity to talk about one of the probably lesser known agencies in the state of Indiana. We have about 100 employees, and we do animal health, a lot of animal health, whether it's animal movement, disease control. We do food safety. Our division is the largest. It's Meat and Poultry Inspection. It's actually meat and poultry processing inspection more than actual inspection itself. And then we have the dairy division. So I thought, well, this is probably relevant to most people in this room, right? Everybody's had a pet, or your family's had a pet sometime in your life, right? You like a nice steak now and then? Yeah. Everybody likes dairy products, right? Milk, and cheese, and ice cream. Anybody like eggs? No, we don't do eggs. But that's the egg board here at Purdue. And I see so many faces. You know, John said I might know a few people. Heck, I think I know half the room. Dean Hooper over there was Associate Dean when I was in the veterinary school. Jim Leslie here, and Rodney and Mary Jo, and so many people from Purdue in the community. It's nice to be here. Talk a little bit about that.
Not necessary.
Well, I also did a little research on Kiwanis because I wanted to know a little bit more. I was in a different service organization in Lafayette for 20-some years. We won't mention their name. But I'm impressed by 600,000 members, over 80 countries around the world, and all the work that you do for children and their communities. It's quite remarkable. I was in Key Club in high school. That's a Kiwanis.
That's right. Yeah.
And I got to think my dad was in Kiwanis in Terre Haute. I don't think Russ, of course, Russ Portman was a lifelong member here. I remember coming to Kiwanis with John and Russ a couple times, and my other club that will not be named has met with your club occasionally in joint meetings for coaches, talks, and so forth.
Yeah.
It won't be named. So, John made practice so much fun. We had a lot of fun in practice. And practice can be a little bit stressful. You've got cases and surgery, and you've got, of course, personnel issues and inventory issues and budget concerns and all those things that come with small business. And so, I'll talk about my age a little bit here. How many know of Baxter Black? Heard of Baxter Black? He's called a cowboy poet, philosopher, writer, right? He's also a veterinarian, which you may or may not know. I also, when I think of John, I think of another guy you probably know is Norm Crosby. Remember him? Kind of a fractured linguist. He never got the words right. He always used them inappropriately and so forth. John was kind of a blend of Baxter Black and Norm Crosby, right? So if you know John, he's got a lot of poems, a lot of songs, a lot of stories. He says he had a lot of useless information, but it sure made practice fun. So. And Russ, God bless him, my gosh, Russ Portman. You never met somebody you didn't know, right? You never met a stranger? Had a very twisted sense of humor, too, sometimes. God bless him. So, John, I was thinking, I just heard a story the other day about memories. There was a guy that decided he'd ride his bicycle around the neighborhood one day and he did like a little exercise, and he saw a young boy in a yard, and he had a lawnmower with a sign on it that said, "For sale." The gentleman stopped and he talked to the young boy a little bit, and he said, "How much you should want for your mower?" The boy said, "Well, I just want enough to buy a bicycle." The guy thought for a minute, and he said, "Well, how about if," he said, "I could use a lawnmower. How about if I trade you my bicycle for your lawnmower?" The boy looked at the bike up and down and thought a minute and said, "Can I ride it first?" He said, "Sure." So the boy got on the bike and he rode around, and he came back and said, "Mister, you got yourself a deal." So the guy decided he'd try that mower out. So he gave a pull on that rope, pulled it a second time, third time, nothing happened. So finally he said to the boy, "I can't get this mower to start." The boy said, "You have to cuss." "You have to cuss." And the man said, I can't cuss." He says, "I'm a minister." He said, "I've been a minister most of my life. I've been saved so long I don't remember how to cuss." Well, the boy looked at him and happily said, "Keep pulling out that rope, you'll remember." Well, I guess I'm supposed to talk about something else. Okay. So, after 25 years of practice with John and Keith Flum and knowing Russ Portman, 1980 to 2007, except for a couple of years John mentioned over in Illinois, we sold our practice to a corporate entity, and I decided it might be a good time to do something else with my veterinary degree. So I saw an opportunity at the Board of Animal Health, and I've been there 10 years. And if you're not familiar with the Board of Animal Health, it has some functions we'll talk about. The state veterinarian is also the Office of the State Veterinarian, and some of you may or may not know, but Dr. Brett Marsh is the state veterinarian. He's our boss and agency head. And Brett was a few years behind me in veterinary school, and I think he's the longest serving state veterinarian since 1994, of all 50 states. He's long serving, and one of the most respected too, I must say. So, what is the Board of Animal Health? We are not the Department of Health. We are not Department of Agriculture. We're an agency of our own. And our charge is, as it says up here, prevention, detection, control, eradication of infectious, contagious, communicable diseases. Of animals, of course. Processing and distribution of products derived from those animals. Control health hazards that may threaten public health. So we have a lot to do with human health, at least in terms of zoonotic diseases. Those are diseases which can be transmitted from animals to people, and in food safety and other things. The guiding principles are access, expertise, outreach, representation, and responsiveness. So to provide information and resources to constituents, expertise where we can. We do a lot of outreach in terms of education and awareness training. Constituent input with legislators regarding issues that they may have. things that we think need to be changed in terms of laws and statutes. And then we try to be responsive, whether it's to emergencies or being proactive for things that are changing in our environment, animal health, human health, food safety, and so forth. Primary missions of our Board of Animal Health is the animal health aspect, food safety, emergency preparedness, and animal care has kind of come in, ironically, more recently, in that we are mandated to also oversee or have jurisdiction over dog breeders in Indiana, and also establish livestock standards for livestock care. Some lesser known functions, we also register brands, and yes, cattle still have brands, and those brands can be registered. We also license renderers who pick up deceased animals or parts of animals from processing plants. At animal disposal oversight, we also give licenses to livestock markets. We are not, we don't have anything to do with veterinary licensing. We get calls sometimes from our fellow veterinarians asking about that, but that is a professional licensing bureau. We don't really have anything to do with pharmaceuticals for animals, although Board of Animal Health does have authority over the biologicals, namely vaccines. We are not animal control. We always get calls about a dead raccoon in my yard. We don't do that. Animal control is local. And we don't have any oversight of our pet shops, which may seem a little ironic, but we do not have that oversight. So it's called the Board of Animal Health, obviously, because it is a board. Not many agencies actually are governed by a board, not in our state nor in many other states. But our agency does have a board, and we have quarterly meetings. I'll try to get through this boring stuff and get you some information that's perhaps more interesting. But our board is 11 members are appointed by the governor. They're industry nominated positions, usually 4-year terms. Some members serve 2 consecutive terms. We meet 4 times a year and go over various aspects of our governance and what we do in our jurisdictions and how it impacts poultry industry, swine industry, cattle industry, movement of animals, quarantines, things of that nature. So the board, this is the 11 positions. You'll see that we have a representative from the poultry industry and sheep industry, swine, equine, dairy, beef, a small animal veterinarian. And of course, they always worry about political affiliations, so there can be no more than 4 of a single party in the pink area. And same above, we have a representative in general veterinary medicine and also somebody from the Purdue Veterinary School, as well as livestock markets on the board. So we have 103 members. We have 17 veterinarians in our agency. 11 are in the field. Each of those veterinarians has a specialty or a director of a certain type that we'll talk about. We have animal health specialists that do investigations, whether it be possible neglect cases, whether it be investigating illegal meat processing, dairy violations, things of that nature. We have 10 veterinarians around the state. They work out of their homes in each one of those areas that they're responsible for. For instance, Dr. Strasser up in the Northwest, she works with aquaculture. You may not be familiar with that, but there are 40 or more aquaculture farms in Indiana. And they'll raise meat fish, they may raise bait fish, they may raise shrimp, and it's more commonly thought of in the southern states, but we have 40 such establishments in Indiana. Dr. Lamb is up in LaGrange area, and he works with the beef cattle associations. We have Dr. Lovejoy in south central Indiana, and she does a lot of humane handling and neglect case investigations. But each one of those veterinarians has a specialty. So animal health is probably what we are known for the most around the state. Reportable diseases, that is, veterinary and animal health reportable diseases are reported to our agency. Foreign animal diseases, what are those? Those are things that are not endemic to the United States. Foot and mouth disease comes to mind. You may recall back in the late 90s, early 90s, something like that, John. Foot and mouth disease was in Britain, and we hope we never get it here because it would really shut down our livestock and our food supply. Emerging diseases, things that are previously known or undiagnosed, new emergence of old diseases. And zoonoses, I mentioned that earlier. Our agency tends to have one health type of approach. We work closely with the Department of Health, Department of Environmental Management, Department of Natural Resources, trying to make sure that our animals and people are safe, because there are a number of diseases which can be passed from animals to humans. Think of rabies, tuberculosis, things of that nature. So these are slides I thought you might find most interesting, or more interesting. In animal agriculture, Indiana is really a powerhouse. We're only the 38th state in terms of size. And Indiana, you may know, is the smallest state west of the Appalachians. But we're number one in duck production. And that's because of Culver and Maple Leaf Farms up in northern Indiana. Number two in egg production. Can you believe that? Nationwide, number 2 in eggs. So we must have a lot of layer hens. That's why they're number 3. And it goes hand in hand. Swine, number 4. Now, I know Iowa has a lot of hogs, and I know North Carolina has a lot of hogs. I had no idea Indiana was number 4. But we're number 4 in swine production. Number 7 in turkey, and rising with a bullet because we have a big turkey processor now down in Du Bois and Knox County, far best. We have a lot of dairies. Wisconsin was always known for being a big dairy state. My dad, bless his heart, said their state motto was, "Come smell our dairy air." But actually I think Florida has outpaced Wisconsin as far as dairy production. But at any rate, Indiana has 16% of the milking cows in the United States, mostly in the northern part of the state. And we'll talk a little bit more about dairy. But our agency is then rather vital to protect this $4.2 billion industry we call animal agriculture. So another thing I put together I thought you might find interesting, and by Indiana numbers, we have 40 million poultry. And that's the layers, pullets, which are young hens, less than a year of age, and broilers, those are the meat birds. 40 million of those. 55 million turkeys. 4 million swine. And these numbers are a couple years old, so they're probably more higher. 800,000 cattle, 100,000 horses, 100,000 sheep and goats in the state. Over 100 commercial dog breeders. You hear about puppy mills and the problem with puppy mills and raising puppies that are diseased and not cared for properly. I'll tell you one thing, Indiana has kind of is at the forefront in commercial dog breeders. We have a lot of Amish folks down in the Odin area of Indiana, up in the Shipshawana area, that are doing a wonderful job raising puppies, getting them vaccinated, wormed. They have hotel-like conditions, and I'm not kidding you. They're really, really nice. And then we have the 40 aquaculture farms we talked about. So we also do a lot of things with animal movement. If animals are going to be shipped for sale across state lines, or they're coming into Indiana, or if animals are going to 4-H or county state fairs, they need to have what's called a CVI, Certificate of Veterinary Inspection. And our agency, again, because of Dr. Marianne Ash, is probably number one in the country as far as electronic submissions of this information now. It's become the standard. So instead of paper, which is hard to read and decipher sometimes, it can all be done digitally or electronically now. And by January of next year, by far the majority will be submitted electronically. It's more accurate, more efficient, and it allows our people in our agency to trust epidemiologically if there are disease outbreaks around the country or around the state. When you have an electronic database, it's easier to search and find those animals, whether it's a food outbreak issue or something else. So it saves animal agriculture time, money, and hopefully lives in the case of a disease outbreak. Rabies, in Indiana, of course, you always hear about bats, raccoons, skunks that can carry rabies. Indiana law requires that all dogs, cats, and ferrets 3 months of age or older be vaccinated against rabies, and that can only be done under the direction of a veterinarian. I don't know if anybody's heard of this. This happened earlier this year. It's called Sole virus. Now, not the Pointer Sisters, but this is Sole like in Korea. Sole virus is a hantavirus type of virus. Can cause death in people. It's not quite as severe as the hantavirus outbreak in the southwestern part of the United States. But the CDC was concerned because infected breeding facilities sold rats to Indiana breeders and pet owners that might have had the Sole virus. And so one of the more interesting things we've done recently is some of our veterinarians went out to ratteries. That's scary, right? Ratteries are places where they breed and raise rats for pets or to feed to your snake or Komodo dragon or whatever you might have. But we went to those locations to draw blood and check to see if the Sole virus was here in Indiana.
What did you find?
None. Good. That's good. Good. Tropical ticks. So Amblyomma variegatum is a type of tick on tropical reptiles and amphibians, and they can carry a rickettsial disease. Rickettsia is a small organism that can infect the blood and blood cells, causes what's called heart water disease. It's a lot of different clinical signs and symptoms, but it's called that because it causes a pericardial effusion or water around the heart. It's devastating to cattle in Africa. It's one of these foreign animal diseases we don't want to have here. But it was this tick was found on reptiles imported through Florida on savanna monitors, and they would have been imported to our state. So that's one of the things you'd have no clue about, but our veterinarians tried to trace down 2 Indianapolis area pet shops that had these reptiles, and those ticks were not found. What you may have heard some in the press, there's been a lot of press releases. In 2016, there was a case of cattle tuberculosis. Still an ongoing investigation and testing program in southeastern Indiana. 2 positive cattle herds on 3 different farm sites were positive for tuberculosis. And of course, tuberculosis is a zoonosis or a possible transmission to humans. And so it is a human animal or human health concern also. So it was also found in 1 white-tailed deer. And without any other traceability evidence, we think that it probably was introduced to this herd or these 2 herds through white-tailed deer because there were no animal movements to other states or anywhere else that tuberculosis could be traced to. White-tailed deer are not a common carrier of tuberculosis, but it can happen, and it was found in this 1 deer. So what happens when you have tuberculosis? You don't want it to get in the human population. You don't want to get in the food chain, although that's very unlikely. You also don't want to hamper our livestock industry by not allowing movement of animals into and out of the state. So a 10-mile radius was set up around those index herds, as they're called, that reached into 5 counties. And so USDA and our agency and our partners local, federal, and state, had to test 6,000. You wouldn't believe a 10-mile radius. You have 6,500 head of cattle and 380 herds. Good Lord, that's a lot of cattle. Along with the 2,000 hunter harvested white-tailed deer were tested. So, all that's been done, and it was done before the end of last year. And now, May of 2017, BOAH has begun, our agency has begun to notify owners of the USDA's requirement to test a smaller radius, a 3-mile radius, around that herd a second time. Why is this important? Because we don't want to have we want to maintain our TB-free status so that our dairy cows and our beef cattle don't have restrictions or can't be moved to other states. So we want to minimize any testing or movement restrictions. Avian influenza, January of 2010, Southwest Indiana, acute mortality. You've always heard about bird flu. It also comes up when you talk about human flu and why you have to get a flu shot every year. Well, why do you have to get a flu shot every year? And why does it always come from Asia? Well, because that's where the birds go. These influenza viruses mutate very quickly. They mutate very quickly. And that's why even the flu vaccine isn't always 100% effective, because they're guessing at a likely mutation in advance based on what's been found in Asia. Because over the winter, birds travel south and they go north, and they go up to the Arctic Circle from Asia, and they come down through very specific flyways through North America, and that brings influenza virus. Well, not only can it cause flu in humans, but avian influenza can devastate poultry industry. And so there's high pathogenic viruses and there are low pathogenic viruses. They mutate rapidly, and in the case layers in Southwest Indiana, I think they had a whole house of layers that were healthy in the morning, and by evening they were dead. So it's very, very quick to work, and it's very acute. Very acute. So anyway, the impact is devastating. And how did we try and control this? Well, obviously you don't want it getting out and devastating everybody's chickens and affecting the food supply. So again, a quarantine, restrictive animal movement, and about the only way to take care of this, unfortunately, is depopulate those hen houses and those turkey farms. And so 400,000 were depopulated in Indiana, in that one part of Indiana. And it required disinfectant and cleaning, and then a lag time before they could repopulate. So, for instance, poultry producers, they're out of income for 6 months, a year, and that can be devastating, whether it's commercial or private. So disaster preparedness is something we also do. You remember the Henryville tornado? We were there helping with animal issues, whether it's livestock or pets. We have a trailer and we can take various supply. We work with Department of Homeland Security, animal health emergencies, of course, man-made disasters or natural disasters. The last thing we want to talk about is food safety. The Dairy Inspection Division, they inspect both dairy farms and also dairy processors. So the Nestle plant in Anderson, dairy farm grade A, we have 1,000 of those grade A dairy farms. So that's producing milk to be pasteurized for human consumption. Manufacturing grade, we have 46. Those are the milk producers for ice cream and cheese. 14th in the number of dairy cows in the United States, 14th in milk production. $700 million in cash receipts for Indiana farm income and $89 million in dairy exports from Indiana. Technologically advances, this is something new to me. They have robots now. I'm not talking about automated milking machines. I'm talking about robots that will prepare the udder, apply the machine, collect the milk. The animal comes in and out on their own. A robot can do 60 cows a day. And we have one farm in northern Indiana with 24 robots, times 60. And they want 24 more. It's one of the largest robotic dairies in the country. And each robot's $200,000. Are you kidding me? My goodness. So, and we have Edie's Ice Cream, Dean's, Ready Whip, Kroger's. I mean, the names are very common in our daily lives. Raw milk continues to be a challenge. People want to drink raw milk. They think it's healthier. No, it kills you. It can kill you. Statistically, drinking unpasteurized raw milk has 840 times more likely to cause illness, 45 more times to require hospitalization. 100 years ago, we started pasteurizing milk because people were dying, and now people think it's healthier. It's nuts. It's nuts. It's only consumed by 3.3% of the population, but causes 96% of illnesses from dairy products. It's not legal for sale in Indiana for human consumption, nor can it be sold across state lines federally. But they find ways. They say it's for your pet. Yeah. And then this is my division. We have 47 of the 100 employees of BOAH. We have inspectors all around the state. It's really not inspecting meat per se, it's inspecting the process, sanitation of equipment, record keeping, HACCP plans, sampling. We do a lot of sampling. We sample product, we sample the surfaces that it's worked on. We look at their record keeping and make sure that they're meeting their critical limits for time and temperature when they cook product. We have 27 states have inspection programs like us. So why do we have programs for meat inspection when USDA has one? Well, USDA approaches the states that are interested in this because they want to foster the small entrepreneurs, right? So they pay us half of our budget to help administer these programs. Ours are not our 120 plants are not the ConAgras or the Delphi Meat Packers or Logan Sport. Ours are mom and pop. They're all privately owned. And so we help them to grow. We have a special cooperative interstate shipment program where now some of our processors can apply a federal market inspection and send their product across state lines. Typically, state programs products can only be sold within the state of Indiana. But we now have 7 of our plants that are in this cooperative interstate shipment program. We have to meet the same as requirements as far as legal jargon in our rules, technology, training, laboratory expertise from the state lab. So this program is funded 60-40 by the federal folks, and the 7 plants that are doing it love it because they can have their own special label, which looks like this. It still says USDA inspected and passed Department of Agriculture. But down on the bottom you'll see it says SEIN, and that's different. You don't see that on most federal products because that means they're a selected establishment in Indiana, the IN. They are our plants, they're our state inspectors, but they are applying a federal mark, which is nice. So we have 50 harvest facilities where we have an inspector on site looking at the live animal until it's in the cooler. That's our legend or our mark of inspection. And these products can only be sold within the state. And that's because you can't have a recall with a state legend that goes to Ohio or goes to Washington, D.C. or goes to Seattle. If there's a problem, who's going to go get it? We can't go into another state. In any event, benefits to Indiana from our inspection program is we have $25 million annually contributed to the state's economy from freezer meat alone. You see signs along the highway that says freezer beef. And so Indiana inspected plants employ 1,500 people, and each worker earning over $30,000 annually. So that's a big impact for Indiana's economy. So in wrapping this up, our greatest challenges or maintaining services to all these sectors of animal agriculture. Livestock industry, growing pet populations, rising popularity of wildlife and exotic, concerns for animal well-being, and still maintaining trained, experienced staff in a competitive job market. I'll be glad to take a few questions if anybody has anything. Thank you so much for your time.
John, you want to wrap it up?
David, thank you for being here. And we have a small gift from the Kiwanis Club for you.
Well, thank you.
Avian, thanks for coming.
All right, very, very interesting, Dave. A lot of us are farm boys, and I grew up down in Jasper, Indiana, and I know about the turkeys and all that good stuff, so it was very interesting.